This is a new center that we've opened up that's designed to help improve the quality of imaging in clinical trials. So what we do is we run clinical trials for vascular devices all over the world. And the end result of those is that the images have to be of good enough quality that we can independently adjudicate them and provide the data to a sponsor or a regulatory body, whoever. And so what we've done up until now is we've had to travel all over the world to teach people how to do these images correctly. It's obviously hugely time consuming for us, but it's also very expensive and time consuming for sponsors. And so we developed this training center that's actually like a central hub so that technologists or physicians who are going to enroll people in these trials will come to Boston, work on state-of-the-art equipment in a fantastic facility that will allow them to really learn how to do this right. So we are only in the peripheral vascular space. So that talks about stents and balloon catheters in the legs, aortic aneurysm stent grafts, renal artery devices, carotid artery stents and devices, dialysis access grafts, all of that stuff. And the technology we use is a currently commercially available state-of-the-art ultrasound scanner. So we actually think that there is an opportunity to use the facilities to train physicians to do a better job of diagnosing disease in their patients. And although that's not the major focus of it, we're already talking to people who are interested in this. For example, emergency room physicians are now spending a lot of time with handheld ultrasound equipment in emergency departments trying to tell if somebody's got a pericardial effusion, a bad aortic valve, so that they don't have to wait for the echo tech to come in or admit them for the next day. And so we're talking to emergency room trainers about how we can use this to train young emergency room rising stars. Well, I think it's going to be successful largely because if we can impact the quality of results and we can show that more of the images that are done are interpretable and reliable, that will be our grade of whether it's been effective or not. We anticipate that some people will find the geography and the travel a challenge, and so we built the training centers to be fully electronic and digitized. So we can do live web-based training, we can record it digitally and store it on a website. So if someone's running a clinical trial, they could have that training module on there so anybody can look at it whenever they want. So we anticipate that we're going to have to be responsive to the market. Even things where you think that it's very routine, like a CAT scan. If you talk to people who do those, to really do them for research, it's different than doing them as part of your routine practice. And so you have to do it all the same way. Oftentimes that same way is not how you would normally do it in your clinical practice, so you have to learn those new things. So I do think that this has an opportunity to promulgate around. I actually don't know of another place that's doing something like this, and fortunately for me, this grew out of a grateful patient of mine who at the end of one episode of care said to me, "I'd like to do something in return to support something you're doing." So I actually had a philanthropist who helped make this possible.